Dravet syndrome is a severe developmental and epileptic encephalopathy characterized by frequent, prolonged, and treatment-resistant seizures that begin in the first year of life. However, Dravet is not limited to seizures. As Dravet patients grow, they experience significant cognitive stagnation, speech and motor impairment, and profound behavioral difficulties that resemble autism, obsessive-compulsive disorder, and attention deficit hyperactivity disorder. In approximately 85% of patients, Dravet syndrome is caused by mutations in a single copy of the SCN1A gene. This leads to a reduction in the production of NaV1.1 protein, the alpha subunit of a voltage-gated sodium channel. NaV1.1 is present primarily in GABAergic inhibitory interneurons in the brain. This deficiency leads to profound loss of GABAergic inhibitory tone and concomitant runaway excitatory activity. Currently approved therapies for Dravet may reduce seizure frequency, but none address the underlying genetic cause and neurodevelopment impact of the disorder. Encoded's ETX-101 aims to be a one-time gene regulation therapy for SCN1A positive Dravet syndrome. ETX-101 is a non-replicating recombinant adeno-associated viral vector serotype 9, comprised of a transgene containing a GABAergic cell-selective regulatory element and a functional gene with instructions to produce an engineered transcription factor. Recombinant AAV vectors are non-pathogenic, and serotype 9 is especially well suited to treating neurological disorders because it shows wide distribution in the brain and spinal cord, targeting mainly neurons. Once AAV reaches the target tissue, it is recognized by the cell and internalized via endocytosis. Following endosomal escape, AAV delivers the transgene to the nucleus where it is converted into double-stranded DNA and undergoes circularization, stabilizing the transgene as episomal DNA outside of the patient's genomic DNA. With ETX-101, the GABAergic cell-selective regulatory element works like a switch that turns on transgene expression, preferably in the intended cells, the GABAergic inhibitory interneurons. Once expression is initiated, the transgene produces a messenger RNA transcript that codes for an engineered transcription factor that is designed to bind to a conserved genomic region upstream of the SCN1A gene and promote its transcription and subsequent translation. Rather than increasing the number of SCN1A gene copies in the cell, ETX-101 delivers instructions to increase activity of the endogenous SCN1A gene, resulting in upregulation of NaV1.1 protein to physiological levels. In animal models of Dravet syndrome, a single dose of ETX-101 delivered via intracerebroventricular injection achieves broad distribution throughout the CNS, increases SCN1A expression, and NaV1.1 protein production. These lead to a significant reduction in premature mortality and hyperthermia-induced seizures. In patients with Dravet, a single intracerebroventricular injection offers the potential for reduced dose requirements of ETX-101 to achieve broad transduction in the brain, resulting in a favorable balance of safety and potential efficacy. Encoded's investigational gene therapy for SCN1A positive Dravet syndrome, ETX-101, aims to be a one-time, disease-modifying therapy with the potential to address the full range of clinical manifestations by targeting the underlying genetic cause of the disorder for long-lasting benefit. For more information, visit us at encoded.com.